The coronavirus has officially been declared a global threat, but response begins in the community with support from our own levels of government. Our guest has been working that frontier for more than 40 years as founder and first executive director of the Codman Square Health Center in Dorchester, and later as president of the Kearney Hospital. To share some observations of what should be done with the new threat, we'd like to welcome Bill Walczak. Thank you very much for being with us, Bill.
Happy to be here.
Well, you've been in healthcare for all this time. Does this remind you of any episode in the past when we had to get our act together?
Yeah, the HIV or AIDS, initially we called it AIDS, eventually it became HIV, but in the early days nobody really knew how it was spread, how things were happening. People were panicking, and so the government had to do prevalence studies. For instance, we sent bits of blood that was left over from blood tests to the government, which determined what percentage of the population actually had HIV, because we didn't know that kind of information, and therefore we couldn't know how likely it was to spread to other parts of the population. And then we did other tests. Tests became very available, and that's the first step that you need to do in order to prevent viruses from going to epidemic, or in this case, pandemic conditions. So that's the kind of thing that it reminds me of, although this is a very different circumstance in that it's spreading across the population via respiratory, by breathing, by sneezing or whatever, and that's a very different situation.
At least when something lands on a surface and then somebody else touches it.
I know, I'm thinking about this surface right now.
Right. Well, most of the people who do get this, and I know a lot of people are supposed to be getting it, it's going to be a mild case, if anything. So why is it so important to do a whole lot of testing very early on?
Well, because it spreads very, very rapidly. There's one thing about this particular virus is different from the flu, is that this spreads much more rapidly, and we're seeing it now, what they call community spreading of the virus, which means that there are people walking around in our communities that have it that are asymptomatic or have a very mild case and don't think anything of it. And unless we can identify those people who have the virus, the coronavirus, we're not going to be able to get them to stay away from other people so that it doesn't spread as rapidly. The second issue is for people in like my age category, or people that have immune conditions that would make it likely that they could be very seriously harmed by this. No, it's a killer. I mean, this virus is a killer to certain groups of people within the population. So preventing the spread to that population is a really important public health issue. And that's the kind of thing that we really should be focusing on right now.
And if I'm not mistaken, one of our top health officials in the country here says that the odds of being killed are a lot higher than they are for a common flu, right?
Yes, between 10 and 30 times, depending on what the data that you're looking at.
But what's the next step? I mean, first of all, everybody seems to agree now we ought to have a whole lot more testing. Why is that not happening?
Well, the federal government really botched this big time, right? So when other countries, the smart countries like Singapore, were seeing things happening in China, they produce a lot of test kits. Right now in South Korea, there are 10,000 tests being done every day so that they can identify the people in South Korea who have this virus and therefore have them separated from the rest of the community so they're not spreading it. The United States, as of this past Monday, had 1,500 tests done, and we produced 75,000 test kits. China is producing 1.5 million test kits per week. And then, I just heard on the radio that Stanford University has just produced their own test kit because our government has not responded in producing enough test kits so that we can actually determine with the prevalences of this virus, and also how do we ensure that people who are getting this virus stay away from other people who could be harmed by it.
This is Being in the News, and we're talking with Bill Walczak, founder of the Codman Square Health Center. But what about the control of population flows, even just internally? I look at what's going on in Italy right now. Top government officials are saying we got to shut all the restaurants down, and I mean, are we headed for that?
Well, I did this article for the Dorchester Reporter, which compares, based on something I read in Bloomberg, what happened in Singapore, where they have had 166 cases because they were on top of this issue right at the beginning. They test everybody. They test everybody's temperature and all that kind of stuff, which, by the way, I happened to bring today. so that people I interact with, I can find out whether they actually have a high temperature. But so those are the things that happened there. But in Italy, they waited. In America, we waited. So are we likely to move towards Singapore? No, we're not. We're actually more like Italy in that we waited. We don't have enough test kits. Right now, if the very limited number of test kits that are available in Massachusetts, I know, like, for instance, the East Boston Health Center got 100 kits for 110,000 patients. And so in order to be able to get a test, you have to call the Department of Public Health and ask for permission to give the test, even if you have a test on site. That's just wrong, you know? And I know that they're doing it, they're rationing it because they don't have enough test kits, but we should have been out ahead of this. You know, back in January, when it was really clear that this was extremely spreadable flu, or virus rather, you know, that's when we should have ramped up our efforts to try to create lots and lots of test kits, knowing that this, you know, it's been said many times, viral conditions don't know any borders. And so we wind up with this now. We don't have enough test kits. We're not screening people for having this virus, and as a result, it's spreading through the community through asymptomatic people who are walking around and have the virus and are spreading it to other people, many of whom could be in very grave danger because of this.
What about that border between patient and provider? The people who work even in the health centers, can you picture now what they must be going through?
Well, it must be pretty horrific because there's no vaccine for this. And so if you get it, you just get it. Now, hopefully, you know, for people that are younger and all that, apparently it's not virulent for that group of people. But if you're immune, if you have some sort of immune suppression, immune conditions, or some kind of disease, then it is can be very virulent with them and kill them because you wind up with pneumonia and other things like that. So for working at a health center, I'd be a little scared about it, although, as you pointed out right at the beginning, for certain people, certain groups of people, this is not, not anything more than just kind of a really, really bad cold. But for people that are in danger of dying from this or having really serious consequences or fibroids in their lungs and, you know, serious damage being done, this is a really serious issue. And as long as we don't know who has it because we're not doing screenings, then it's going to be really difficult to prevent it from spreading through a much broader population than currently is in there. I mean, the state is saying we have 95 cases. We have 95 cases because we don't do tests. You know, come on, let's be real here. It's like, you know, if you did more, as soon as we get more tests in, you're going to see that number skyrocket. People who are basically panicking now, everybody I know is panicking about this, are going to really panic when they start seeing the prevalence of this virus. Even though most people will not be seriously harmed by it, the problem is that it's spreading very, very rapidly through the population.
One thing the neighborhood health centers have been doing for a long time is serving the immigrant population. That means people who, even if they have legal status, there might be some lack of clarity about what care they're eligible for. Now we have the public charge rules that came out recently. What do you see happening when this slams into COVID-19?
Well, this is a really serious issue because our federal government has made it very clear that they don't like immigrants and they're trying to prevent them from accessing health care, for instance. So if you're on Medicaid, if you're a Dominican immigrant and you're on Medicaid, you could wind up not being able to get a green card or losing your green card as a result. And that fear is thread through the entire community of immigrants. And so if we really want to stop the spread, we would make it very, very clear that, you know, that the test is free and you don't have to worry about ICE coming in and arresting you because you got a test. But we don't do that now because we have really bad leadership in Washington that's whose policies are basically going to result in a far more extensive spreading of this virus than should have happened.
You have one other hat as an educator as well, because you co-founded a charter school. You know, right now with all these colleges and universities cutting back on in-person education, what about K through 12? I mean, you got parents who have to go to work. So what should be happening with the schools?
Well, I've been part of conversations about that a lot lately, and I'm also the chair of the board of Bunker Hill Community College. And just give you an idea from the Bunker Hill Community College perspective, the community colleges have decided that they're going to try to stay open because so many of the students don't have computers. They don't have access to the internet. So if if they were going to tell people that they could continue their coursework over the internet, well, a lot of them can't do that. So a lot of them depend on the libraries of community colleges in order to be able to have access to the internet. So from that perspective, they're going to try to stay open. But we know that there's a case in the Chelsea campus, and so of Bunker Hill Community College, and so the next several days they'll be shut down, and then we go into a week of vacation, school vacation. In the local, the K to 12s, that's really scary because or daycare centers. Good God, they're petri dishes for bacteria. So what happens then? Well, it gets really difficult. Low-income people largely have jobs, or many of them have jobs where they don't get any sick time. So and a lot of them are one paycheck away from bankruptcy. So what do you do in those cases? Are they going to stay home if they feel sick? Probably not. It's like, well, you're going to be homeless if you stay home from sick, but if you're sick, but you may not have the COVID virus. So overall, this is going to be a really complicated case because of the way we structure our benefits and policies now. And on the K to 12 side, the Elliott School is closing all 3 of their campuses because of one possible case there. If that happens across the board, we're going to see our society kind of grind to a halt.
The President's speech last night, a lot of emphasis on international border security, some talk of payroll tax relief. What was your impression?
Well, the interesting thing is, leave it to Trump to decide that it's always a foreigner that's causing the problems here. No, Europe has the same issues that we have, and in fact, they're doing a better job than we're doing on it. So if he's trying to claim that, now the Europeans are people that are giving us COVID-19, that's nonsense. It's absolute nonsense. In terms of like a payroll cut, well, we're already spending $1 trillion we don't have, an extra 100 or 200 or 300 billion dollars. It doesn't sound like a catastrophic thing. But on the other hand, what we should be focused on is the public health aspects of this. Not if we can deal with the public health aspects of this, the economic issues will follow. You don't deal with the economic. If you have just dealing with the economic issues on it, it's not like people are going to get cured quicker. That's nonsense.
Thank you very much for being with us.
Happy to be here.
Bill Walczak. We'll have more news in just a moment.